Hello guys, hope you all are good and safe. In this video, I'm going to discuss all about black fungus. What it is also referred as, and can the disease contagious from person to person? And what are the ICMR guidelines in recognizing and treating of this disease? And what is the reason behind death of 40 to 80% of people associated with this deadly fungus? And what is the underlying mechanism behind steroids leading increased attack of this fungus? And what are its presentations? How do we diagnose it and treatment? So let's go further. Covid-19 associated mucormycosis, which is commonly referred as black fungus, it's an aggressive fungal infection, and the fungus belonging to a group of mucormycetes group of fungi, which is usually present abundantly in the natural environment, especially in the soil. So, did you know one thing that ICMR on May 9, 2021 issued guidelines for recognizing and treating COVID associated mucormycosis. So, ICMR released an evidence based advisory on screening, diagnosis, and management of mucormycosis. In sight of its rapidly growing number of cases, the government of Rajasthan declared it an epidemic on 19th May 2021. And also, the governments of Haryana, Tamil Nadu, Telangana, Gujarat, and Bihar were also declared COVID associated mucormycosis as an epidemic. So, what are its presentations? It usually presents in two forms. One is Rhino-orbital cerebral mucormycosis, which is called as ROCM, and another one is Pulmonary Mucormycosis, which usually infects sinuses and lungs through respiratory system. Okay, what we need to do after getting affected with this deadly fungus? So, we need an early aggressive treatment is considered a very essential in treating this mucormycosis patients. So, what is the reason behind death of 40 to 80% people as COVID-associated mucormycosis? So, it usually depends on the site of infection and prolonged ICU stay, glycemic status, comorbidities, and steroid usage of the patient. What is the underlying mechanism behind it? So, steroids are life saving in moderate to severe COVID patients. So, while reducing the inflammation in the lungs, it also reduces the overall immune response and significantly increase the sugar levels in both diabetes and non diabetics COVID patients. Okay, let's come to know about its two presentations. One is Rhino-orbital cerebral mucormycosis, which is also called as ROCM. So, okay, here are the symptoms here. I presented in a flowchart to you. So, through air droplets, it usually infects first the nose, which is stage 1. So, what are the symptoms the patient presents to us is nasal blockage, congestion, nasal discharge, pain, which is very localized, and coming to the sinuses. So, through nose, it enters the sinuses. So, in the sinuses, it's stage 2, that is facial pain, numbness, sweating of the face, headache, orbital pain. So, we'll find these all things. And coming to the orbit, so it's a bony cavity which surrounds the eye. So, the patient presents with headache, orbital pain, blood or double vision with pain. Okay, and partial or complete blindness, vision loss in one or both eyes, and next to the brain, which is also referred as stage 3. So, here the patient presents with unstable gait, altered consciousness, and seizures. Okay, what are the other symptoms the patient presents? Like toothache, loosening of teeth located in the upper jaw, dysfunction in jaw movement, paresthesia or abnormal sensation in the skin, tingling, chilling, burning, or numbness, and fever, skin lesions, black scar on the skin near the eyes or nose are common. Let's have a look on pulmonary mucormycosis. So it primarily affects lungs and respiratory system, and which is very common among immunocompromised patients. So what are its symptoms? The patient presents to us with fever, cough, shortness of breath, chest pain, hemoptysis, and pleural effusion. How do we diagnose mucormycosis? So we'll diagnose this through radio imaging studies like MRI, paranasal sinuses, with brain contrast study for ROCM, that is Rhino-orbital cerebral mucormycosis, and plain CT thorax for pulmonary mucormycosis. How do we treat this? What is the treatment of COVID-associated mucormycosis? So first and foremost thing is to cut down the root cause of this. So we need to control diabetes, and we need to discontinue immunomodulation drugs, and we need to judicious use of steroids should be attained. Time, dose, duration should be monitored. Antifungal drugs if the condition detected early. We have certain antifungal drugs which can be given to the mucormycosis patients and surgical debridement in most of the cases. And most commonly used antifungal drug for this condition is amphotericin B. Liposomal amphotericin B is a very commonly used medication for this. And that's it, guys. Thank you. Hope it's useful. This is all about black fungus. And if you find the video is helpful, please share to your needful friends. And thank you.